So good morning. It's so wonderful to be here with all of you. Thank you, Kathleen and Helen, for launching this morning. Thank you for the opportunity to share a few welcome remarks. I'm very excited that we're joined by Representative Ruth Briggs King. Thank you for being here and for your work and leadership in this area. We know it takes the leadership of all of us to focus on reducing the toll of cancer in our state. And as someone who's not only a family physician and often is advocating for my patients to make sure they receive adequate cancer screening, I also have been personally affected by this issue, as many of you, but I feel like every kind of cancer has affected some member of my family at some point, whether it's prostate, thyroid, breast, stomach, lung cancer. And so the issues that you're focusing on are so critical to save lives. I also thought I'd share just a few remarks about the big picture view of healthcare in our state. We know that the work that you're doing to promote good health and urge cancer screenings, early detection, and treatment is important for the health of our state, but also to really get a handle on healthcare spending. For years, many of you may have heard that we really are on an unsustainable path when it comes to healthcare spending. We don't talk about it often enough, but certainly when we had the budget crisis that we went through and survived successfully with Governor Carney's leadership, we saw that healthcare contributed tremendously to healthcare costs. Our total healthcare costs for 2014, based on the best data we have, was actually 27% higher than the US average. And we estimate at the current pace, the Center for Medicare and Medicaid Services says that Delaware's healthcare spending will more than double by 2025 if we don't reach a more sustainable trend. So imagine the cost for premiums and co-pays and co-insurance that patients will pay when they're trying to access the services that we know they need are based in best evidence if we stay on this path. And think about the incredible impact this increase would have on patients who are treated for cancer, their incidence, their mortality, and the choices that they may make as they're pushed into more high deductible plans. All of those reasons are why Governor Carney, with his past leadership with the Cancer Consortium and the Healthcare Commission, said, we have to take this on, we have to look at healthcare, and he signed Executive Order 25 last November to create healthcare spending and quality benchmarks. The subcommittee of Delaware Economic Financial Advisory Council set this initial benchmark in this year at 3.8%. That is much closer to a sustainable trend line, where in the past we've been at 5 to 6 and maybe even more % per year. That means when we start to add up all of the healthcare spending in our state, whether it's hospitalizations, physician visits, nursing home care, lab tests, home care, you name it, it should not be more than a 3.8% growth trend year over year. And in fact, after this year, we're going to see this trend line decrease. It's a goal, it's a transparency measure, it's not a penalty or cap, but we want to work together, and work of the Cancer Consortium can help us get there, because it does take collaboration, it does take everyone coming together. We also know that Governor Carney wanted to focus not only on costs, but quality of care and population health, and how we start to look at all of the factors that are really contributing to increased costs. We're the only state to take this on. There are 2 other states who have a health cost spending benchmark, but we are the only state that has now paired it with quality measures. They deal broadly with issues around primary care supply, which is critically important when you think about screening and chronic disease management. But they also have to do with substance use disorder and opioids right now. And we also are trying to look at a range of measures around cardiovascular health, which we know that smoking contributes to long-term cardiovascular health and disease, contributes to heart attacks and other long-term consequences. And we're going to start tracking both smoking rates and obesity rates for adults, because it has a direct connection to healthcare costs, and we know that the work that you're doing will contribute to us being able to achieve those targets. As Secretary of Health, this is what I see. Despite the investments in healthcare and the work of groups like the Cancer Consortium, we still rank only 31st in this overall health of our state compared to all other states. We know we can do better. The quality measures will help providers focus on areas, but also allow us to come together and collaborate on some key issues. We also know that one of the factors greatly impacting Delaware's healthcare costs is tobacco use. And as you know, lung cancer is the most frequently diagnosed cancer in our state. Smoking is the #1 risk factor for lung cancer. I love the lungs that are sitting out front. I can't wait to take a picture out there with them. But this is just one way we're trying to get out the word. Every year, nearly 1,400 adult Delawareans die from smoking-related illnesses, according to the Centers of Disease Control and Prevention. One of the quality benchmarks I mentioned is our adult smoking rate. We started at a baseline rate of 17% of Delaware adults who smoked in 2016. Our goal is to be aggressive and get down to a rate of 15%. Now, I know in this room, many of you will say that's not low enough, so let's keep going and exceed our expectations. One of the strategies that will help us make that goal is Senate Bill 25, which raises the age in our state to buy tobacco products from 18 to 21. Tobacco-Free Kids estimates that up to 400 Delaware kids under age 18 will become new daily smokers every year. Senate Bill 25, which Governor Carney will sign into law tomorrow, will help us reduce the number of young people who will become adult smokers in our state. We're excited. No, we definitely should stand up and jump and cheer. This will extend people's lives, and it will help us reduce overall spending in tobacco-related illnesses. We estimate that tobacco-related medical expenses cost Delaware $500 million per year, including $95 million of Medicaid spending alone. The workplace productivity losses add another $391 million to that total, according to the CDC for our state, and that's more than $900 million total just for us here in Delaware. So reducing tobacco-related burden is an issue we should jump up and cheer about. It is a win-win. We thank Governor Carney, the General Assembly, the Cancer Consortium, and other advocates for your support of Senate Bill 25. And that's why this policy change is so important. Lung cancer continues to account for an enormous share of Delaware's overall cancer burden. From 2010 to 2014, lung cancer accounted for 14% of all newly diagnosed cancer rates and 30% of all cancer deaths in Delaware. And I get to highlight our accomplishments in lung cancer and what we're doing around tobacco, but we know that the work around multiple cancer prevention and treatment strategies has been huge, and largely those successes have been due to the collaborative work that's happened here at the consortium and with other stakeholders. So I expect with the signing of Senate Bill 25, those numbers will continue to improve, sparing more Delawareans the pain and loss associated with lung cancer and other tobacco-related illnesses. So we have made progress, and there's more progress to make. We all have more work to do collaboratively. I thank all of you for being here and for your commitment and leadership and helping us build a stronger and healthier Delaware for all. Thank you for this opportunity to share some words of welcome.